Welcome back to the Mind Haven podcast, powered by Imperium Psychiatric Group, where we spotlight the innovators building bridges between clinical care, mental wellness, and whole person healing. Today's episode is close to home and deeply personal to our mission. My name is Shanti Hubbard, and I am the neuromodulation therapist here at Imperium. And joining me are two powerhouse nurse practitioners and the founders of Ultimate Drip Therapy and Wellness, Regine Patillo and Schwanna Fortenberry.
Hi guys.
Hi.
These women are more than medical entrepreneurs. They're community leaders, blending family, geriatric, and adolescent care with integrative therapies that center the whole human experience. We're so honored to welcome them into the Imperium ecosystem and collaborators in our holistic care journey. Let's explore what it really means to care for the full person, mind, body, and spirit. All right, guys, so let's start with why did you start Ultimate Drip?
Well, we started in the height of the pandemic, and our thought process was hey, we're nurses, we're nurse practitioners. We always take care of people when they're sick and ill. And this was a time where people were just dying, and the medical community did not know the cause because it was a new pandemic. We were learning. So Sean and I thought of why don't we try to keep people well? Let's focus on that. So that is what really drove us to open Ultimate Drip Therapy.
Okay. So I know you said during the pandemic and there were so many questions that people had and not enough answers. Was there any other gaps you were hoping to fill? Just the preventative care part?
Well, access to healthcare, that was one, because during the pandemic, everyone was terrified of going to the hospital when they were sick, dehydrated, they just did not want to step foot in the hospital because everybody was afraid of catching something. So we really did fill that gap where if someone was feeling dehydrated or even if someone was sick with the flu, we all forgot about the flu back then because that wasn't a thing during COVID, but there were still other viruses and things going on. So I think we really did fill in that gap for that part of healthcare.
Absolutely.
I think so too.
Absolutely. Having a safe place to go and be able to feel safe. Like, yes, the place you know is safe, but actually feeling that sense of safety is a huge deal. What made you open a med spa specifically though?
Well, I think initially our thought was to create a spa like environment so that people could still have access to care and still receive top quality care without being in a clinic like setting. So that way it would make them feel more relaxed, more comfortable, and that way they would enjoy coming and focusing on wellness and preventative health without feeling like, oh, I'm just, it's just another clinic, just, just another hospitalization or somewhere else where I'm surrounded by sick people. So we wanted to like change the narrative. And that's exactly what we did.
You absolutely did. I remember when we just saw you guys last week, you were talking about the way you started. Can you mention a little bit how you went from one little room with people waiting in a long line to how big you guys have gotten now?
Okay, so we started in a 10 by 10 suite and we stayed there. We only had like four chairs and then we stayed there maybe 4 months. And then we moved to a 10 by 20 suite. I think it was 10 by 20. And we added aesthetics. We added like two more chairs. And like our clients were like waiting out in the hallway. So eventually we did move to a 3,300 square foot building a few months later. And so that's where we are now, from a 10 by 10 suite to a 3,300 square foot building.
That's a huge jump. Which things do you offer at Ultimate Drip?
Well, we offer IV hydration. We do aesthetics, which includes Botox fillers. We do mesotherapy, weight loss. We do TRT, which is testosterone therapy for men. And we are looking to launch our women's hormone and bio identical hormones. So that's in the works. And besides IV hydration, we do vitamin injections and some primary care. And one thing we do for our clients, if they come in, they say, you know what, I've been sick, I'm not feeling well, I don't want to go to the ER. We're nurse practitioners. So we decided to buy like the kit that you would get from urgent care, where we could test you for flu A and B and COVID. So we do have the capabilities.
That's awesome. That's really seeing how your vision of helping people who didn't have a place come here and be able to get everything.
Pretty much, yeah.
Yeah. Well, we're so excited to partner with you guys with Imperium because we see how that can collaborate with the psychiatry, with the talk therapy, neuromodulation, which includes neurofeedback as well as TMS, so transcranial magnetic stimulation. How do you guys see what you offer integrating into what we hope to bring to the different communities?
I really see a great partnership. One, just from some of our clients, we've been with them for so long, we kinda know their entire history. We're not mental health providers, so now we can have, you guys to say, "You know what? You probably really do need to check Imperium, mental health out." Just to give them that, somewhere to go to discuss some of the things that they're going through. So we do have a couple of clients already in mind that we're gonna recommend to you guys, but we have couple of IV drips that we've used in the past for clients who say, you know what, I am so anxious, I have anxiety, it's through the roof. We have a drip, for example, called Hello Mellow. And what's in there is calcium and magnesium. And those are ingredients or vitamins that relaxes people. So people usually say, "Hey, that really calmed me down, it really helped." And the good thing about that is, yes, you can get it over the counter, but we tell people you only get 30% of those vitamins by the time it goes through your gut, your digestive system, breaks down, go to your bloodstream. It's only 30% by then. The IV, you're getting 100% of that. So you can watch people just feel so relaxed while they're dripping. Some of them even fall asleep. We give them eye shields sometimes, so it does work.
And I'm so glad you said it like that because I was going to ask you to maybe describe a client that came in and you noticed a big emotional and physical shift.
Mhm. So, yeah, I would say the Hello Mellow, it helps relax. By the time they leave that chair, they can instantly they tell us they feel so much better and more relaxed. And having that spa environment already, it's usually a quiet space with little music. We usually ask you what kind of music or genre you like, and just to have that atmosphere. But you're not only it's like a holistic experience. It's medical and then, it's holistic.
Absolutely, and it sounds like you make sure it's tailored to each person, especially by asking which music do you want? Because I know some people enjoy the classical, some people that doesn't calm them down. I know me personally, classical music does not do it for me, but for some people it is amazing. So having that personal touch and then being able to give them the IV drip that's gonna best work for them and then have a tailored mental health experience that is specific for them with a person that they feel comfortable with. That's definitely a great way that we all are gonna be able to collaborate.
Right. And another thing that we're going to collaborate on is ketamine or Sprivo.
Privado?
Spravato. I'm sorry. Yes. So those are, we are planning on bringing that into our practice once we collaborate. It's not something we offer now, but that's definitely something we're going to integrate once we collaborate with Imperium.
Absolutely, being able to tackle each area, and there's so many different areas, but as many as we can to help people really truly feel that holistic healing.
Yes. Yes, definitely.
I think one benefit of ultimate drip therapy and Imperium working together is it gives us the opportunity to focus on the person as a whole, to address them and really provide holistic care. And their care won't be as fragmented. They're coming to us for IV drips, they're coming to someone else for this. So I think that that will really decrease the fragmented care that a lot of patients are getting nowadays.
Absolutely, and it really sounds like it ties into the vision that you guys had when you first started, being able to come in one spot and address all your needs. So having your drip here at Imperium, having some of Imperium workers be at your location, again, 3,300 square feet, super impressive. So having some of us over there, like people won't feel like they have to do what you said, travel to all these different places to get their needs met. And that does stop a lot of people from being able to actually get the help that they need.
Right. And one thing that we do like is you can get it done at the same time. So someone could be talking to you or a therapist or psychiatrist while you're getting your IV drip. So it's really going to be a one-stop shop.
Absolutely. When we're talking about holistic wellness, how do you guys define success? Like a success for a patient, what do you see that as?
Definitely the mind, body, and the spirit. So we know that if someone feels good, they're going to want to look good. So that's where the aesthetics come in. You know, if someone is feeling sad, it could be because they've been made fun of because of the way they look. They are overweight. That's when we come in with the weight loss plan. So it's going to integrate holistically with every part of this merger and this partnership.
Absolutely. Because you guys work with different groups of people, so from adolescents to middle-aged adults to seniors, what do you wish mental health providers knew that would help them treat these age gaps accordingly?
I would say one thing. I'm sorry, Sean. This just sticks out to me. One thing for sure is vitamin D level. Ever since COVID, even the younger generation, it seemed like everyone has been low in vitamin D. So you may get someone who say, "I'm just not feeling up to it. I'm just dragging. Am I depressed?" It could be something simply as the vitamin D level that's, truly low because it can cause depression. It does cause fatigue. So I think that in itself, if you're a mental health provider, along with whatever clinical assessments you guys do, that's when we will come in to look at what are their labs looking like? Why are they feeling tired, chronic fatigue, and stuff like that? So it's going to be definitely a very holistic approach to making sure people feel good.
Yeah, absolutely, and that's something I do talk to my clients about too, like, always addressing first the physical. So, we need to make sure your physical health is good before we try to figure out, is it actually something going on with my head? Because if your hormones are off balance, we could talk all day, but that's not gonna help too much. So I definitely tell them about getting a full blood panel with their PCPs and checking that vitamin D level because that's not always included, but you have to ask for it. Being an advocate for yourself, that's a big one that we have to learn in the medical field.
Absolutely.
When we talk about that, like a lot more research has come out about the link between vitamin D and depression. And if it's low, you'll see more.
Absolutely.
Many of our clients, and I'm not sure if you guys face the same thing, but many of our clients have trouble navigating the stigmas between getting help, between people knowing that they have a psychiatrist. The society has gotten a lot better, but still, you can say, "Oh, I talked to my therapist," but feeling a little bad about getting the medication part maybe. How do you feel like creating safe, culturally competent, because that part hugely matters too, spaces will help clients truly feel seen?
I think that's gonna be really important because even though we provide like, IV therapy and one thing that we do provide is NAD, and that's become really popular. So like I have a client that's scheduled on Wednesday. They've been dealing with alcoholism, and instead of them going to a therapist or getting they wanna come to me. I mean, I'm not a therapist. I mean, but I empathize with anyone who battles with addiction because there are several different types of addiction, not just, drugs, alcohol. People are addicted to food. They're addicted to, You name it, you can become addicted to it. Sex addiction. So I empathize, even though I've never been addicted to alcohol. So I think that piece of empathy really pours into someone that's battling with, an addiction versus always coming, from a clinical point. So I just think that all of that will kind of just into um, play into an important role in people, dealing with different things, and it'll help us as providers to help them as well.
Absolutely. People respond differently. They respond better when they actually feel like you care. But you mentioned the NAD. Can you explain a little bit more about which one that is?
NAD is we all have NAD in our cells, but the older we get, of course, the levels decline. So NAD can be the benefits. It targets the mitochondria of the cell, which is like the powerhouse of the cell. But many of the benefits that come along with NAD injections or NAD infusions can be increased energy. It has like an anti-aging effect because, of course, the younger we are, the higher our NAD levels are. So, energy, memory, concentration, focus. A lot of people do utilize NAD for like addictions because what it does is it takes away that craving, kind of detoxes your cells, and it takes away the craving that a lot of people have for drugs and alcohol. So that's definitely, it has lots of benefits, but even weight loss, it helps with metabolism. So it kind of like turns back the chronological clock, which is why it has become very beneficial. Some people are even using it for, issues with fertility. So, I mean, it's lots of benefits, and it's become really popular. So a lot of people are turning to NAD when they're like, hey, I'm dragging, I'm extremely fatigued. So, we always want to, aging doesn't mean you have to feel depleted, foggy, or powerless. We're here to help you and to say, hey, we don't want you to wait until you get sick. Let's do something. Let's be proactive versus reactive.
Absolutely. And I think that's a really big shift that has happened, especially in the mental health field. Like we're trying to target the stuff beforehand, get more preventative stuff out, talk to younger people how to take care of yourself. And even with the physical aspect, we're not waiting till we're older to try to make sure our skin is clear, like develop a routine first. We've come a long way.
We have, yeah, I agree.
Which drip would you say is the most popular?
I would say the Myers cocktail only because everyone knows it. And a little history about the Myers cocktail is that was one of the first cocktails back in 1966 created by Dr. Myers. And his goal was to help people who are suffering with autoimmune disorder. So it became so popular, everyone knows it. So when they come in, they may not know anything, but they'll say, let's try the Myers, only because they've heard it along the way. But it has everything in there. I call it like everything but the kitchen sink type of drip. Every vitamin you can think of, it's in there. It's in the Myers cocktail.
Having so much of so many different ones that doesn't overwhelm the system.
Mm-mm, no, because your body takes what it needs and then it will flush out the rest. And you have to remember when you take the over the counter stuff, you're only getting 30% of it. So your body needs it.
Definitely.
Yeah.
It's trying to find it anywhere it can.
Yes, absolutely.
I know we mentioned like some things that we're excited about as far as partnering. Like we're excited that patients are going to be able to be in one spot to get all of their needs met. Well, majority of their needs met. Is there anything else that you guys were super excited about when it comes to partnering with us?
I think that is the main thing. And also that we can actually refer some of our clients to you guys' service because we do have, quite a few clients that will benefit from it. And before we used to just say, oh, just Google one near me. Now we actually have someone we can say, hey, this person is really good at what they do and they can help a little bit more than we can. We can take care of the medical and the physical, but I think you need a little bit more than what we can offer. So having that under one roof, one umbrella, it makes it so much easier for them. So I'm happy about that.
Absolutely. I know because you guys do have so many different kinds of patients. What's the youngest that someone can come and get a drip?
So we do adolescents. Sean is a F&P, which means she can do children. So she would tend to do more of the kids if needed, like 12, 13. I try to stay with teens and up because I'm adults and geriatric. And so I can do teens under my license. I just can't do anything less than that. And we do see a lot of teens as well. So if your clients have teenagers who are in sports or athletics, this is the time in August we see them, especially the football players, because in Texas, it's hot and they need to be hydrated. And something recently happened in the news, Sean. You said, was it a kid had a stroke or something? Heat
Yes, that
stroke?
had a heat stroke. So that just really, yeah. So that, and now they're in a coma. That child is, I mean, so I think that's something that probably could have been prevented with the proper education. Um, that hydration is very important and that you don't have to just go to the emergency room to get hydrated. So even though a lot of people do know about IV hydration and how that it's easy to access. I think there's still a lot of education that needs to be done in the community to increase the awareness surrounding IV hydration because we definitely want to do whatever we can do to prevent something like that from happening again. Regine and I were discussing even if we provided concierge service to those those athletes, when they're practicing, we don't mind doing that because that's definitely something that we want to prevent that from ever reoccurring because not only did this, he had a promising, college career ahead of him. He's had over 20 offers from, different colleges. He's in the Cy-Fair school district, so my daughter knows him. And so that it saddens me that his health is
Never changed.
forever changed due to this.
I think even as far as educating people the difference that water isn't enough for hydration, because some people think, "Oh, I drink a whole bunch of water, so I should be fine."
Right, because we hydrate you on a cellular level, which doesn't matter how much water you drink, it cannot hydrate you like on a cellular level. The first thing you do when you go to the emergency room, the first thing they do is they put an IV in you and they give you hydration because they know, or the medical community, we know how important that is.
Well, on this topic, what else would you say is being underserved or maybe just misunderstood in the community that you guys could educate about when it comes down to drips?
Just the many benefits. And we're still researching and learning all of the different benefits, especially when it comes to people who have battled cancer and, different treatments or vitamins that can help, you know, with not preventing cancer, but lessening your chances of cancer reoccurring, which is, the combination of vitamin C high dose and alpha lipoic acid. So I think all of those are just those are things that we definitely could educate the community on different treatments that are not just treatments that's offered in the hospital. And I mean, I get it myself, and I don't have cancer, but of course I get it because I know that it's something that I know the benefits of it, and so I do. I feel like being proactive versus reactive is the key to having a healthy life, with longevity.
Regine, is there any myths or debunking you want to say about what the community may think about drips?
No, that's pretty much it. I know being in medical, we tend to push medicines a lot. So we have a approach of yes, in conjunctive to whatever you're doing, let's add these essential vitamins, which is backed by studies showing X, Y, and Z. And that's how we really operate. We don't tell people to stop doing what you're doing. We tell them in conjunctive to whatever your therapy is, let's introduce this. An example to that is we get a lot of people from MD Anderson, believe it or not, and they are sent by their oncologists to not us per se, but they'll tell them, hey, studies have shown high dose vitamin C helps shrinks the cancer cells. So seek out a location that does high dose vitamin C. So not a lot of IV therapy drips do high dose vitamin C, but we do. So we kind of get that trickle from MD Anderson. And it always feels good as a nurse practitioner seeing the progress of our customers or clients that have cancer. They come to us, they're doing whatever they're doing at MD Anderson, plus they're getting the high dose vitamin C. And for them to say, hey, I'm ringing the bell tomorrow, that's always the best feeling because that's why we do it. That's exactly why we do it.
Yeah, that's awesome. Do you ever get anyone that's maybe nervous about what the treatment is or how their bodies may react?
More nervous just about the IV stick, I think. That's the most that we get. And then after that, they're like, oh, it wasn't too bad. You got me on the first try. Like, yeah, that's all we do here. Our motto is our goal is to stick you once and that's it. That's our motto. Most of the time it happens that way, but there are a few exceptions, of course.
Of course, because everybody's not the same. So,
Right.
and you did mention you guys also started doing Botox and stuff. What made you expand to that too?
It wasn't because we just wanted to expand, it's because our clients didn't wanna leave our chair and say, "Hey, can you offer this? Hey, can you offer that?" So almost everything we offer, I promise, it's from our clients saying, "Hey, I've read the journal saying this and this. Have you guys researched?" And we would research and we would try it on ourselves, and then we'll offer it. So even the weight loss, Sean, is it okay that I say that we were both on the okay. We were both on, the semaglutide, and we were our own test dummies, before we introduced it to everyone. So, it's always good when we see clients who've been with us since 2021, and they're like, "I don't even recognize you. You're getting smaller. So if it feels good. So, we try everything we offer.
And that's beautiful to be able to say, like to know that you're not just giving something that you have no personal experience with.
Mhm.
How long did you guys do the weight loss thing, if you don't mind me asking?
Girl, we're still on it, but we do maintenance. We're doing maintenance.
We're on it for life.
Yeah. We do maintenance, and maintenance could be once a month injection. It could be every other week. So it depends on how your body process. And I'm a stress eater and not being anxiety or anything, just a stress eater. If something's going on, I'm going to be putting something in my mouth, eating. Work is busy, I'm eating. So I know that that's my trigger, so I know I have to be on it at least once a month just to, ring me in and say, hey, stop eating so much, calm down, relax. It's good.
I mean, we all have our coping skills. Some of them are more healthy than others, but we all have our coping skills and recognizing that no human is perfect. So,
Yes, yes, absolutely.
was there anything else that you guys wanted to add? Like, as far as any questions about Imperium, any highlights, any concerns?
So we've met the staff, and you guys are so welcoming. And I know our clients will be ecstatic to have you guys. We are kind of two different personalities. We're like, and you guys are very serious and you guys listen. You know what I'm saying? Like this is what you do. You guys are mental health, so you listen. So I think it would benefit our clients 100%.
And again, we are so excited, like, to be able to offer because our mission is to help the whole body, not just, like, yes, we want to help their minds, but your mind is tied to your physical self, which is tied to your spiritual self, and we want to address all of that, so being able to collaborate with you guys and introduce this additional way to help them in one spot, we're so excited.
Yeah, and mental health was definitely a piece that we were missing. So we're ecstatic about that.
Regine and Shauna, thank you for so much, not just for your clinical excellence, but your deep commitment to human centered care. At Imperium Psychiatric Group, we believe healing doesn't happen in silos, and this partnership reflects what's possible when mental health and medical wellness join forces. To our listeners, if you're looking for care that honors every part of you, your biology, your trauma, your goals, you found your people. So visit Imperium.com or check the episode notes to learn more about our integrated services and community partnerships. Until next time, stay well, stay grounded, and stay whole. Thank you.
Thank you.
Thank you. Bye bye.